we're really looking at what are the specific things that need to be integrated inside the system at every single level for sustainability and for implementation. So we always say you can't train yourself into a person-centered system. It requires a lot of different moving parts. And again, we hope over this course of this next year to begin doing that. Next slide. So some of the things that we're doing, we divide the work up, even though there's a ton of overlap, we're dividing the work up into kind of three big work streams. And you see at the top is the engagement work stream. We really feel like this is the most important work stream, and it's about really engaging with all of you. It's engaging with internally with KDADs. It's engaging a lot with the end users, whether that's an individual who is aging or with a disability or behavioral health, and or their family caregivers, and really understanding what is it that you need to have the good life that you want, and what are sort of recommendations and immediate changes that can be made across the state. And so engagement is a huge part of both the systems change work as well as the training work. And that's really why we wanted to continue to be on these calls. But we have both updates for you and some specific ask for you, because we really want to move into the phase of the project where we really start engaging now more externally facing. The other thing that you're going to see, sorry, can you go back to that slide? In that work is that we will be doing systems change recommendations. So that's both understanding how are we implementing some of the federal requirements? What does it look like at an MCO level, at a provider level? What does it look like on the ground from someone receiving those services? And really understanding some of the sort of, I call them levers, that are going to move the system in the direction of being more person-centered. Again, this comes from you guys. This comes from understanding what you currently have in place and how do we continue to really expand on what I would call those islands of excellence around the state of Kansas. But we have to hear from you to really understand what you think was going to help move those systems along. A big, large component of the work that we're going to get started this year is really around training. And so the first level of that training is really helping people understand what is person-centered thinking? What does it look like? What does it mean to me and whatever role that I'm in? The other part is to also really start understanding, building the skill sets, not only of the professionals in the system, but those that receive your services, and the families. And so how is everybody coming to that table with the mindset of thinking about integrated supports for a good life? We will also be working with KDADs and some of the other state partners to identify, what do you guys already train on? Are there things that can be improved? Do you guys have great training? How can that be scaled amongst other learners? And then specifically, what does that look like for training related to some of your what I would call your functional requirements, the primary tools you're using, the planning documents, and those sorts of things. So we're still at that gathering phase, and we want to gather that information and really hear from all of you and build upon that. Next slide. So this is really high level snapshot, but whenever we're beginning this conversation, we are spending time really mapping out the systems and those that are interacting with the different waivers. This is not completely built out, and it's intentionally not built out because the idea is as we continue to grow and build on this visual with you guys. There are times that we'll be specifically thinking of who's really in this sort of ecosystem related to the developmental disability system. Who really is working inside the autism system? Are we thinking about all the different providers and all of the different organizations that we should be engaging with and hearing from, both to understand what needs to be changed within the system, but two, how are we sharing and building that knowledge base around what person-centered looks like and what those practices are. So with that, I'm going to pass it over to Amanda, who's going to share with you some of the sort of engagement activities that we have planned, and some of the training opportunities that are available. Amanda?
Thanks, Shelley. Good morning, everyone. Or sorry, good afternoon. So we have planned some opportunities for all of you to come together, all of you involved with the system for long-term supports and services in Kansas. So Kayla, if you could go to the next slide. So this really is an opportunity for us to connect with more people, and we'll come to you. We really want to create this opportunity and an environment where people feel valued, heard, and supported. So we're going to be visiting a region near you in the next few months. And while we're doing that, we know we want to meet people, we want to bring people together so we can help you strengthen connections with all the people involved in the system, service providers, self-advocacy groups, individuals, families, MCOs, KDAD staff. And if you, we're going to talk about an opportunity to be a host. And also it's an opportunity to just get out there, network, get to know people, and increase kind of that visibility of who you are and what you bring to the table. So we can go to the next one. We're proposing these events be a day long, really from like 10 to 3, 9 to 2, that kind of a thing. And you'll take away an overview, an understanding of the Person-Centered Transformation Initiative that Shelley just talked about, and an overview and an introduction to Charting the Life Course framework and principles. And then it's not all us and people talking at you. It really is an opportunity for you guys and the others that attend to share your vision of person-centeredness in the system and have that really uniquely come from the people in your region, because we know that will not be the same for every region across the state. There will be some similarities, but we really want to know what will work for you. And you'll get to help shape the future for the home and community-based services. And we'll also be going through the upcoming opportunities for training and more engagement at these events. So if you can go, okay, so this is how we selected the regions. There's already a nice setup here for the 7 regions. And again, who we want to recruit: individuals, families, those end users, self-advocacy organizations, MCOs, providers, and state staff. So we really get this great group of people coming together to engage and listen to one another. We're going to be looking for regional hosts in each one of these regions. And with that host, we'll figure out the best date. But we really like to start in the end of February if possible and go through March and April, and then have a little space left at the end of the spring for any makeups due to weather. Okay, can you go to the next slide, please? Okay, so are you interested in being a regional host site? We would love for you to be interested. In your role as a host site, we're going to set up a virtual planning meeting, which will be on February 3rd, where we'll bring all those interested in being a host site together to talk through roles and responsibilities. But you'll be working with us, the staff at the Nexus, to plan the whole thing. You're not out there on your own, but we need your local area expertise. You know where the rooms are. You may even have one at your organization. You know where the best place is to get lunch, because we'll be supporting lunch for all of these events. And we need some like on the ground support with setting up the room and making sure it has what we need. And you guys know who needs to come, right? You have those connections locally, and you can reach out and encourage people to attend. And we just know that you have, again, that local expertise. So what will we do? We will help with the hosting and work with you all the way up to the date of the event to make sure we know who's coming. We'll cover the expenses for lunch, the meeting room, travel stipends if needed for those end users, family and self-advocates. And we'll work to create a flyer or an email link or whatever you need to disseminate. And then we'll bring the team of facilitators for the day of the event. Okay, and this is how you would get involved. We have a survey that you can fill out, and I believe Kayla is going to drop that in chat. at some point today, so you can go ahead and get a jump on that. If not, we'll be sending out information in an email blast after this session. And next slide, that one's looking a little odd. Not sure what happened, but we also have oh, Carrie. Yeah, if we could just go. Yeah, there we go. Great. Thank you. Okay, so wanted to let everyone know that we have a training and engagement opportunities just around the corner. We have the Showcase, which is a national event where people come together from all over the country, either as providers, end users, families who want to talk about how they're using Charting the Life course in their lives to bring about good lives and create meaningful change. So again, we encourage all of you to come. There'll be a registration link. It's just in Kansas City at the end of April 29th through May 1st. And that is also an opportunity on that first day of the conference. We have some intensive workshops, and one of them is going to be our new fundamentals training, which is Charting the Life course, really a person-centered thinking kind of one-day experience where you can apply the principles and tools of Charting the Life course. And that'll be the first time that that's offered. It's a brand new course. And then the next one is, any of you interested in just getting going with Charting the Life course training? We have open series that are all virtual and people can join those. We have an ambassador series. We have badges if you're interested in improving your skills in using Charting the Life course and facilitating meetings. And then the fundamentals course will also be available online. And that link will give you that information. Any questions, feedback? We'll be watching chat to see if anything comes through.
Okay, I think Carrie's audio is out, so I might take, I'm gonna test it real quick. Okay, you got it.
All right, is it working now?
Yes.
Okay, I have no idea what happened. I muted and unmuted and now it works. So thank you, Megan, for jumping in. So if you'd like to share your questions out loud, you can raise your hand and we'll call on you and invite you to unmute. If you need to find your raise hand button in your toolbar, you should have a button that says react. In mine, it has a heart. And if you click on that button, you'll see the raise hand option. And let's see here. I saw the registration links got put in the chat. How do we indicate we want to participate? Will we be notified by email? Thank you, Kayla, for that response. There's a form online that you can fill out if you want to host an event. If you want to attend, there will be more information getting sent out. I presume to the KDAD's listserv. I saw some nods. Okay, great. All right. Well, thank you all so much for the great information and all of the efforts that you're putting together for this effort and person-centered planning. We'll go ahead and continue on with our information and updates today. And if you do have more questions for our friends at UMKC, please go ahead and drop those in the chat and they can continue to respond. And with that, I'm going to hand things over to Lee, who is going to give us updates on KDAD staff changes. Here, since you dialed in by audio, you might have to hit star 9 to unmute the first time. Or I'm sorry, star 6 to unmute the first time.
Okay, how are we there?
There we go.
Okay, perfect. Well, good afternoon, everyone. I just wanted to give a few updates on some of our staffing changes that we've had over here on the KDAD side. So Sandy Heston Pewitt is our HCBS project manager. Jamie Katsoulis is our HCBS contracts program manager. Aspen Overlay is our LTSS Senior Administrative Assistant. Kathy Keck is our TA Waiver Program Manager. Just started today is Christina Wrench, who is our FE Program Manager. And then we also have Todd Hogg, who is our FE Eligibility Specialist. So super excited for those folks who have come on in the last month or so since we've met. And you should be able to find their information on our website. But if you have specific questions, I'd be happy to drop those in the chat as well. Yep, Sarah, I'd be happy to do that.
You didn't see the chat. Sarah asked if KDADs could send those names out as well. So
yes, I can put those in the chat.
Thank you so much, Lee. Any other staffing updates today? Lots of new faces at KDADs. All right. Well, I believe then that we'll put Mitzi up next with FMAP, Federal Medical Assistance Percentage Updates. And Mitzi, you'll need to use star 6 to unmute the first time as well. I'm not sure what is happening that it won't let Mitzi unmute. Give me just a second, Mitzi, and all. Right. Sorry for the technical problems. There we go.
Can you hear me?
Yes.
You can hear me? Okay, great. Good afternoon, everyone. Welcome back from it seems like a long vacation from the holidays and everything else. And then, you know, we got the record temperatures since 1888. That's crazy. So as far as FMAP project goes, we have closed applications for supportive technology, and we hope to be in touch with those individuals, businesses and individuals we choose to award this coming Friday. We had 21 applicants for supportive technology, which equated to about 15 million. And we had 9 applicants for self-advocacy grants, which equated to 1.2 million. Other things that we're working on is the direct service workforce and career ladder. That's an ongoing project that will end on 12/31 of this year. Employment First is doing outstanding. We are 240% of our projected goals for employment. There have been 106 individuals between our 4 pilot providers receiving full-time employment. And our 4 pilot providers, just as a reminder, is Down Syndrome Innovations, Compass Behavioral Health, Starkey, and OCCK. Additionally, there's monies that have been provided to our Behavioral Health Commission for IDD mobile crisis for individuals with IDD and co-occurring behavioral diagnoses. Guidehouse is the contractor, and they're currently interviewing folks just to kind of find out systemic issues. I added some links that I think Carrie will send out later, just to let everyone know, the FMAP website, in case you don't know where that is. Also, how to sign up for KMAP emails and notices. Please do that if you haven't done so. And information about the Charting a Life course showcase that is occurring April 29th through May 1st in Kansas City. So we do welcome all of you guys to attend that. And I set a link for that so you can register. And I believe that's it. Thank you. Any questions? Okay, thank you.
I think Carrie is struggling again with audio, so I can kind of take it with my policy updates. A couple of policies that we are currently finalizing are the background check policy and the virtual delivery of service policy. I expect those to be out for distribution on the KDES website within the next month. Still some things to tie up there. I'm sure, as most of you have heard by now, our MFEI project, Medicaid Functional Eligibility Instrument date has been pushed back to 7/1/25. We are holding a webinar today to discuss ongoing updates and all things related to MFEI. So if you guys want to join us for that, I'm going to drop the page in the chat that has a link for the webinar today. If you just go down to the bottom of the page, it should have the December webinar link, and then it should have the January webinar link if you want to look on that. And along with that, on that page is the previous webinars that we've had, I think in the middle or the top of the page. Also, the announcement that we sent out that we have decided to push the go live back date to July 1/25. Any questions, please feel free to attend that webinar today or email there's lots of ways to reach out through that website, or you can reach out to me if you have any questions. There's been a lot, so we're trying to tackle everyone's concerns as best as we can as they come in, but that really is the best way to get the information. Eventually, we are going to start having open office hours to where some of us will facilitate time in the evening for individuals with concerns to come and discuss and let us kind of hash some things out. I did also want to announce that this year we have decided to separate the ADRC contract into 2 different contracts. So that's the ADRC, and then another individual vendor will also be performing the assessing for services like BI, FE, and PD. And we are still reviewing the procurement process for the assessing vendor, but I can announce that the ADRC vendor is Liberty Healthcare. And we are working with them to get an implementation date that we will message out to stakeholders in the near future. So please look for that, and be updating this meeting as updates happen. And we also will be announcing the date for the assessing contract when that is awarded. So more to come on that. I'm going to kind of skip around too on some other updates I wanted to provide. We have a couple of grants that we're working on with our partners PCG, and a lot of these are, kind of helping us get off of our corrective action plan. The first one I want to talk about is the 14C to CIE, which Community Integration Engagement Grant, which is part of the SB 15 funds that were allocated by the legislature. And the 14C to CIE grant is a two-phase grant program that helps employers with 14C certificates transition away from sheltered workshop activities and towards competitive integrated employment, starting with funds to pay all workers with disabilities at least the minimum wage. This plan to launch February 2025. We're going to be doing some more outreach, so please look for that. During phase one, grantees will receive dollar for dollar matching funds to reimburse all wage increases up to the minimum wage for individuals with disabilities. They also commit to participating in phase two of the grant, during which they will work with a TA provider to develop and submit a plan to transition away from sheltered workshop activities. During the rest of the phase two, grantees will use grant funds to follow their transition fund. Additionally, we have we are calling New Day Services Transformation Grant. Plan to launch that here in the next coming months, winter 2025. The New Day grant helps home and community-based services providers adapt their service provisions to align with the proposed unbundling day services definitions, which targeted to be implemented sometime in 2025. We're still working on that date of implementation for day service definitions. More to come on that and how you can be involved in developing those day service definitions. But the purpose of these grants are to help individuals receive day service access, community integrated services, help individuals receiving day service access, competitive integrated employment services like pre-vocational, life skills, career exploration and planning, and individualized employment support, gain relevant accreditation, certifications or licenses, and help staff develop necessary skills, adapt their program to align with proposed day habilitation service definitions. Any fully licensed Kansas-based provider of HCBS day service can apply between $10,000 and $250,000 by themselves or a part of a partnership. And the final grant we are developing is the Conflict-Free Kansas Grant. Plan to launch spring 2025. The Conflict-Free Grant offers Kansas providers funds to comply with HCBS final settings rule and other federal regulations and address conflict of interest, community developmental disability organizations, and HCBS IDD waiver, community service providers, targeted case management agencies, and individuals or organizations who want to start a new Kansas TCM agency are eligible to apply. Grantees can use funds to help them transition to providing only TCM, HCBS IDD waiver services, or CDDO functional, i.e. functions, i.e. intakes, options counseling, and quality assurance. TCM agencies would exclusively provide targeted case management services, while community support providers would deliver only direct IDD waiver services. I know that was a lot to throw at you. We're definitely going to have some follow up on all these items, but I just wanted everyone to be in the know. So. Looks like Carrie's still struggling with her audio, so I can move on, and I'll just move on to the next agenda item. And I believe, Lee, if you have any waiver renewal and amendment updates.
Yeah, absolutely. Thank you, Megan. So for our PD and SD waivers, we had our renewals that were approved, and those started effective January 1st of 2025. So those are up and running. And then we have two current amendments One is for the brain injury waiver, which is removing the use of in lieu of funds for some of our purchases for the unbundled assistive services that go over the $10,000 cap. And then for our IDD waiver, we have an amendment that's shifting from the use of the basis to the use of the MFEI as the eligibility tool. So those are currently with CMS. We've had some good conversations back and forth, and I anticipate to see those back and approved soon. So thank you all that participated in the public comment. We always appreciate being able to have that partnership. Any questions on those?
All right. If you
Okay,
do,
that's
you
all
hear
the
me now?
updates I have. Yep.
All right. Are you able to hear me now?
Yep, Carrie, I can hear
Oh.
you.
Okay. I switched my audio over, so I apologize for that. I don't know what's going on with my computer audio today, but it's decided it's too cold maybe. Thank you all for those updates. I appreciate that and your patience. And Megan, did you get to the HCBS final rule updates?
I don't really have anything for final rule other than, we will be messaging some upcoming trainings that we hope to have before July 1st. So be on the lookout for that, excuse me. And just, that's all I had. I did have some, before we transition into questions, some questions that were sent ahead of time that I kind of wanted to give an overall update on. These questions were sent by Monty, so he might want to come off mute to further explain some things, because I struggled with one of them. But one of the questions that was asked was the status of the KDHE HHA regulation impact on HCBS providers. These new mandates are expensive and there is no funding available for the incurred compliance cost. This is a carryover from the November meeting. There were discussions occurring between KDADS and KDHE. Is that what was said then? And KDADS just wants to respond that this is a KDHE public health item. We have not had any discussions with them, but we continue to engage in this. And Monty, if you feel we need to further discuss this at the FMS meeting, we can kind of flesh that out also. The second thing brought forward, I think this is a good item to discuss with all stakeholders, is I've looked at the governor's FY26 budget, which was released publicly yesterday or last week. What is the status of scheduled changes to the HCBS service rates effective 7/1/25? The released public documentation did not provide those regular updates. And I will say, I don't think there was any proposed updates on those. But while the governor's budget recommendation does not include enhanced funding for additional capacity, does include enhanced funding for additional capacity, not rates for FE, BI, and TA waivers. Those enhancements will need to be specifically added by the House Social Services Budget Committee. The legislature is trying out a new budget process this year and not using the governor's budget as the base budget. Additionally, KDHE and KDADS is conducting a rate study to inform future rate changes discussions. The other one I had is there's an ongoing problem with authorizations not being correctly or timely loaded into the system at the beginning of each month for prior billing. What is the internal state process to monitor the area of the MCO performance? Again, I'm going to put this on the FMS agenda. We have a meeting on 1/27 at 1 where we can discuss this further, but there is an escalation process, and providers who are having issues should continue to drop a note to the EBV mailbox. These issues are then brought to the MCO via weekly calls with the MCOs. The one question I was unsure of, Monty, we can discuss this offline, but What is the update to fixing the current disruptive issue on timely CBCs? And I'm not sure of that one. I just maybe need some more context.
Thank you, Megan. All right. And again, Monty, there is that offer to discuss that more if you would like. And with that, I believe we can move into our questions from folks today. And first off in the chat, there were a couple of questions of whether the information you shared, Megan, would be available on the KDAD's website.
Yeah, we will send that out once it gets updated. We're working on a couple of different streams, so I just wanted to let you all know why we work through these, that these are coming down. I know that they've been discussed in a couple of different meetings, and so I think that it's good to put them all in one place so we can start that discussion, but I will get that information out and provide more details as those develop. So be looking for that in the KDA's website and through our listserv.
Thank you, Megan. And when and how will we get more information about decisions and dates on TCM conflict of interest?
You can follow the listserv, the IDD modernization page that I dropped in there. I do believe has ongoing information on that, or at least some of that is updated on the KDA's website. So we've been providing updates through that. I know there is more to update on that. But if you would look at the KDA's website, probably for ongoing updates.
Thank you, Megan. Right. If you've got a question about the information that has been shared today, you can drop that in the chat, or you can use the raise hand button so that you can ask your question out loud. And again, that raise hand is oftentimes or usually in your React button. So in your toolbar, look for the React button, and then there is a raise hand option. We'll give folks a few minutes to get their questions in the chat or raise up their hand if they'd like. And if you dialed in by phone, then you can use *9 to raise your hand. Question in the chat. What about sheltered workshops that pay above minimum wage? I've only heard talk about the 14C.
In regards to the grant opportunity, I would just say, be looking for that communication, and maybe when it comes out, we'll have more information. We plan on holding grantee information sessions. So, maybe you can join and be able to have a little more context to see if your organization would be able to apply for that, because we will have those grants that also are going to promote community integration and things like that. So for the day service definitions.
Thank you. And if there, that is not what you were meaning, then you are welcome to clarify in the chat what you were asking about if that didn't answer your question. Or again, you can raise your hand. Are IDD providers required to use the Charting the Life course tool over the current PCSP tools in place today?
I would say no, that there hasn't been any policy changes on that. Right now, UMKC is just doing the information gathering. There might be things coming later to changes, but not at this time, Jerry.
Can you clarify which programs will be participating in the rate study you mentioned will be taking place in 2025?
The rate study is going on now, so if you have any questions on if you want to participate or if you qualify for participating, right now we're kind of just focusing. I know we're doing providers other than IDD, but if you want to send me an email and I can get you in touch with our contractor who's doing the rate study, if you feel that you want to be included, I can get you to the right person.
Thank you.
I'll put my email in the chat.
Perfect. On the website, it still shows 2 options for conflict-free case management. Will there be a decision made to which option KDADS will choose?
I believe there is still ongoing discussion on that thing. I know that there is lots of things to be decided, so it is still a work in progress on that. So there's a lot of moving parts to make it all come together. So I appreciate everyone that's been involved in that, and you know, we'll continue to message out those changes as they come. So.
Right. And when are we going to get more information about the day services changes?
In what regards? In regards to the grant or other changes being made? Oh, I think you mean the day services. Yeah, we're working on those, and we plan to have some more stakeholder engagement within the next few months. So be looking for those on the KDADS website. So hope that answers your question.
Yeah.
Took me a while.
There was just a comment, and you can clarify if it's accurate, but that those of us running sheltered workshops are not participating in the time study tool.
I am not sure about that. I'd have to go back and check. So if you want to reach out to me, we can figure that out together.
Great. On conflict-free case management, is this also going into effect July 1st?
No, we're only changing the assessment tool for IDD, the functional assessment tool. That's the only change that we have a date on going into effect of July 1st. So.
Okay, we've got time for one, maybe 2 more questions, if you have them. While you're thinking about your questions that you might still have for me, I do want to remind you that our next call is scheduled for March 17th. It will still be at noon, and you'll use the same Zoom link that you used today to connect to that call.
Thank you, everyone, for your ongoing input in these important matters, and you know, allowing us to take up an hour of your time. And if you have anything that you would like to address, please feel free to reach out. I see one more question: how do we apply day center grants? Again, that information will be coming very soon. So be on the lookout.
Thank you, Megan, and thank you everyone for your time today. This will conclude today's meeting. We'll see you again on March 17th. And we invite you to remember that these calls are an ongoing resource for you to stay up to date on what KDADS is working on. And we look forward to talking to you again next time. Have a great rest of your day.
Thank you.